recent study from the Centers for Disease Control is raising some new concerns about more people being at risk for a red meat allergy that comes from deer tick bites.
Scientists long believed that only the Lone Star tick was responsible for what's called alpha-gal syndrome. Well, that species is not yet established in Maine. However, new research suggests that exposure to various species of black-legged ticks may also trigger this lifelong syndrome.
News Center Maine's Vivian Lee tells us more in this report.
Experts have long held that a rare and potentially deadly meat allergy is transmitted by just one species of tick, the Lone Star tick. Lone Star ticks are found mainly in southeastern and south central U.S., and more are appearing in Maine, but the species is not established here. According to federal health officials, alpha-gal syndrome impacts 500,000 people in the country. However, research released by the U.S. CDC last month shows that two different species of black-legged ticks, also known as deer ticks, can transmit the potentially life-threatening condition.
Certain Exodes ticks, which is a deer tick, is a member of that, in both Europe and North America, can have an alpha-gal-like protein in their saliva. So theoretically, it would be possible that this tick could cause that.
Dr. Rob Smith is the director and founder of the Vector-Borne Disease Lab at MHIR. The research involved two women, including a 45-year-old patient from York County. Both tested positive for alpha-gal syndrome after being bitten by two different species of black-legged ticks. Dr. Smith believes, though, more cases need to be analyzed.
It's always a little bit of a question when it's a new tick species that's being linked and you have one or two cases. There's the possibility there were other factors.
Patients with AGS develop an allergy to alpha-gal, which is the carbohydrate found in mammals, making them allergic to meat, including beef, pork, and lamb, and other products, including cosmetics and medications. Symptoms include hives, swelling of the lips, face or throat, shortness of breath, gastrointestinal distress, sneezing, headaches, and anaphylaxis. Beth Garrison was diagnosed with alpha-gal syndrome more than a decade ago. She was in remission when a bite from a deer tick reignited her symptoms.
I've been anaphylactic in minutes just walking through a grocery store because, they have prepared meals cooking.
Beth co-founded Tick-Borne Conditions United, which offers education, training, support, and advocacy for AGS and other tick-borne diseases. The nonprofit has launched a campaign to get Maine and other states to add AGS to conditions reported to the U.S. CDC. She believes now that federal studies have linked black-legged ticks, which can carry alpha-gal, highlight the need for increased awareness.
How do we educate the public and our physicians to help educate the public and prevent this lifelong condition?
The Maine CDC boosted its surveillance of AGS 2 years ago. More than 60 Mainers have been diagnosed with the syndrome since 2014. Vivian Lee, News Center, Maine.